Have you ever noticed your body sending you subtle signals, perhaps a persistent ache in your knees, a stiffness in your wrists, or a puffiness in your fingers that just will not go away? These sensations can be puzzling, and it is perfectly natural to wonder what your body is trying to tell you, especially when these signals involve your precious joints. Today, we are diving into a very important question. Is joint swelling a lupus symptom? The direct answer is a clear and resounding yes. Joint swelling is indeed one of the most recognized and common manifestations of lupus, an autoimmune disease. It often presents as part of what is medically termed lupus arthritis, leading to significant discomfort and impacting your ability to perform daily activities with ease. To truly understand why joint swelling occurs in lupus, we need to look at the immune system. Normally, your immune system is your body's dedicated guardian, identifying and fighting off harmful invaders like viruses and bacteria. However, in lupus, this protective system becomes confused and mistakenly targets your own healthy tissues and organs as if they were threats. This is the hallmark of an autoimmune disease. Specifically, when lupus affects the joints, this misdirected immune attack often focuses on the synovium. The synovium is the soft tissue that lines the inside of your joints and produces synovial fluid, which lubricates the joint and nourishes the cartilage. When the immune system attacks the synovium, it triggers an inflammatory response. This inflammation is the underlying cause of the classic symptoms we see: pain, stiffness, and yes, that noticeable swelling. It is important to know that lupus-related joint swelling, sometimes referred to as lupus arthritis, often presents differently from other types of arthritis. For instance, it typically affects joints on both sides of your body in a symmetrical pattern. While it can be quite painful and limit movement, a key distinguishing feature is that it usually does not lead to the permanent joint damage or deformities that are often associated with conditions like rheumatoid arthritis. This distinction can be reassuring, but it certainly does not diminish the daily impact of the pain and swelling itself. So, what should you do if you are experiencing joint swelling? If you notice unexplained swelling in your joints, especially if it is accompanied by other common lupus symptoms such as persistent fatigue, skin rashes, fever, or hair loss, it is absolutely crucial to consult with a healthcare professional. They are your best resource for thoroughly evaluating your symptoms and determining whether lupus or another condition might be the cause. To assist your doctor in reaching an accurate diagnosis, consider keeping a detailed symptom diary. In this diary, you can note specific details: when the swelling occurs, exactly which joints are affected, how long the swelling lasts, and any other accompanying symptoms you experience. This factual information provides valuable clues and a clearer picture for your medical team to understand your unique situation. Here is an interesting insight into lupus arthritis. It often exhibits what doctors call a migratory or transient nature. This means the joint swelling might appear quite noticeably in one set of joints for a few days, then mysteriously subside, only to reappear in different joints a short while later. This shifting pattern is a distinctive characteristic that helps medical professionals differentiate lupus from other inflammatory conditions. It is often described as a symmetric polyarthritis, affecting multiple joints on both sides of the body simultaneously, but crucially, without causing the erosive bone or cartilage damage seen in some other forms of autoimmune arthritis. Understanding this specific behavior of lupus-related joint involvement is incredibly helpful. It can empower you to describe your symptoms with greater precision to your medical team, aiding them in making a more accurate and timely diagnosis. Knowing these nuances helps you become a more active and informed participant in your own healthcare journey. Ultimately, recognizing joint swelling as a potential symptom of lupus is a powerful step. This awareness empowers you to proactively seek timely medical evaluation and, if diagnosed, to begin an effective management plan. Early diagnosis and appropriate treatment are absolutely vital for minimizing discomfort, helping to preserve your joint function, and significantly improving your overall quality of life when you are living with lupus. By understanding the intricate ways lupus can affect your joints, you are much better equipped to advocate for your health and form a strong, collaborative partnership with your doctors.